If once you are being diagnosed to be a diabetic, how will you go for controlling your blood sugar? In this context, I want to say that about 7.1% population of average Indian population with average age of 42.5 years are diabetic. In US, 9.3% of US population are diabetic, and 10.3% of European male, 9.6% of European female are diabetic now. But the incidence is growing at a higher rate in India, and so we are telling that India is going to be the diabetic capital of the world. What about controlling diabetes? There are many measures. The first measure is lifestyle modification. That is, you have to control your diet and you have to go for exercise as prescribed by your doctor. This is the cornerstone, and this should be done by all diabetic and pre-diabetic patients. Why pre-diabetic patients? Because complications rate in pre-diabetic patients are as bad as diabetic patients. So they are going to have same complication like a diabetic patients. Then comes the role of medicine. You have to go by your doctor's advice and consume medicine as prescribed by your doctor. And in this context, I have to impress that insulin is a very good drug if your doctor thinks so and prescribed you insulin. You have to take the insulin to keep your blood sugar under control. So, what will be the mantra for controlling diabetes in general population? Number one, consciousness about diabetes. This consciousness is a bit better in urban population than in rural population. In yesterdays, we used to think that incidence of diabetes is less in rural population. But now it is known that rural people are also getting diabetes like urban people. So consciousness is the number one, and for consciousness you have to go for this regular diabetic checkups to see whether you are a pre-diabetic or diabetic. Then comes the control by way of lifestyle modification and diet. And thirdly, you don't have to be very morose once you have been diagnosed with diabetes. Diabetes is not end of life. If you can control your diabetes effectively, you can have an effective and normal lifestyle in compared to non-diabetic patients. And one very important and startling fact that diabetic patients live a healthier life than a non-diabetic patients. Then the question you may ask, why are you telling so? This is important because a diabetic patient is constantly under medical care. He or she is having regular medical checkups. He is going to the doctor regularly. So any small amount of a small disease can be picked up by his doctor in compared to a non-diabetic patient who doesn't go for medical checkups thinking that I am a healthy person. So don't be afraid. If you are a diabetic, you can lead a normal and healthy and effective life if you go by your doctor's advice and if you are conscious about your disease. Stay healthy, stay happy with diabetes.